morning, I am Dr. Shiv Chopra, consultant surgeon and laparoscopist in hospitals in Delhi. Now we come to what is a very common problem, anorectal conditions. Every bleeding which comes from the rectum, people say, "Mujhe to piles ho gaya hai." It is very important to know that piles are usually painless. Painful conditions are very unlikely to be piles. Painful conditions commonly are fissures, fistulas, proctitis. What is fissure now? Fissure is a longitudinal cut. It's a cut in the anal canal. Whenever somebody passes hard stool, there is some amount of trauma to the anal canal. This, with period of time and subsequent acts of defecation, keeps on becoming bigger and bigger and becomes what is known as a chronic fissure. So the treatment for fissures is, if patients come on time, to try and break the cycle. And break the cycle means they take good amount of water, they pass a soft stool, and they are not constipated. If we take care of this, most of the times these patients just need local care and no treatment. But once it becomes chronic, then they have to face the knife. Now we come to what is known as piles. Now piles is basically a pathology. It is not exactly a pathology, it is actually a physiological aberration. You see, our ancestors, they were all four-legged. When we became upright, the pressure, the maximum pressure of the weight of the blood column came onto the rectum. With time, with age, with weakness, with chronic constipation, the rectum starts, the cushions of rectum, they start coming out, and finally they become what are known as piles. So whenever there is any trauma, they start bleeding, and this is the time when patients usually come to us. So every pathology of the anal canal which bleeds is not piles. If it is painful, it is unlikely to be piles, but it is very important that you take cognizance of this and immediately come to a doctor so that you can be treated at the right time with minimal trauma or invasion.